Hello, everyone. Welcome to this webinar presented by the Create Cures Foundation Clinic. Today, we are going to be talking about sugar, carbohydrates, and cancer. And as we're waiting for people to join in and get settled, please locate the chat box and let us know where you're coming from. We're going to be using the chat box throughout the webinar, asking some questions. And then there's also going to be a chance for a Q&A at the end. But for now, just try and find the chat box and let us know where you're joining from. Today, we are coming to you from California, from Santa Monica. And we see Bethesda, Maryland, Boston, excellent, some East Coast people, Argentina, very cool, Flagstaff. Thank you everyone for joining today. We have a ton of information to get through, and hopefully it'll be very interesting for you. And we do record all of the webinars, so if you join late or want to rewatch it again, later it'll be posted on our YouTube channel. See some Dubai, cool, New Zealand, people coming from all over. Thank you so much for joining. So because we do have a lot of information to cover, I'll go ahead and start the webinar. But remember to keep using that chat box throughout. So first, to introduce ourselves in the clinic, Shayna and I are dietitians from the Create Cures Foundation Clinic, which was founded by Dr. Walter Longo, who's a leading researcher in nutrition, especially as it relates to aging, cancer, and other age-related chronic diseases. So at the Create Cures Foundation, we're a team of expert registered dietitians, molecular biologists, and Dr. Longo himself. And we collaborate on care for our patients with the goal of developing effective and integrative strategies to support cancer therapy and therapy for other metabolic conditions and improve outcomes for our patients. One thing that is very important to note is that this webinar and all of our webinars are provided for general knowledge only. They're not a substitute for any professional medical advice, diagnosis, or treatment for specific medical conditions, which would be something that you'd want to consult your healthcare provider with for any questions or concerns regarding your nutrition. However, if you're interested in contacting us to work together, we will share our links in the chat box and also at the end to connect, because we are very happy to connect with anybody who's interested in working with us. And then also just to speak a little bit about some of the most recent work that has come out of Dr. Longo's research. He has two items that came out last year. One is a book called Fasting Cancer, it's an amazing book. I definitely encourage everybody to check it out. It's available at all mainstream booksellers. And then also a documentary called Fasting and the Longevity Revolution. And these both share powerful stories about cancer research or the research behind fasting and really the up-to-date evidence of using fasting and nutrition recommendations in cancer care. So the links are on the screen and also in the chat. And then finally, before we start talking about sugar and carbohydrates, we'd like to introduce ourselves a little bit more. So my name is Lotta Andonian. I'm a registered dietitian at the Create Cures Foundation. I received my master's degree in nutrition, health span, and longevity from the University of Southern California, and studied the interaction of nutrition and genes on disease and longevity and under Dr. Longo at the University of Genoa. I also received additional training through the Institute of Functional Medicine, and my passion is really culinary nutrition and working with patients to help incorporate nutrition recommendations into their lifestyles in an enjoyable and sustainable way.
Amazing. Great. Well, my name is Shayna. I am also a registered dietitian at CCF. And I also studied under Dr. Longo while getting my master's degree in nutrition, health span, and longevity at the University of Southern California. I have a really strong interest in helping my patients use specific foods to help along their cancer journey. So I'm really looking forward to sharing the research about sugar, carbohydrates, and cancer with you all today, because I know that we all have a lot of questions, and we all, both me and Lotte, get a lot of questions about this today too.
Yeah. Very excited to cover this topic today. So, just an overview of what's on the agenda. First, we'll go a little bit into what carbohydrates actually are, an understanding of how they work in the body and different sources of carbohydrates. Then, touch on carbohydrates and their role in cancer. And then talk about the ketogenic diet. We can't talk about carbohydrates without talking about the low carb ketogenic diet and some of its roles in cancer. And then we'll discuss some practical strategies and have a little quiz and time for a Q&A at the end. So with that, I'll pass it over to Shayna, who's going to talk about understanding carbs.
Thank you. Yes, let's talk about carbs. So first I want to start off with our first question. So everybody get your chat box ready. And I want to know from you, sugar from a blueberry, do you think this is a helpful or harmful food? Helpful, depends, helpful. Okay, great. Overall, this is definitely a very helpful food, and we're going to get into exactly why that is. So let's start off from the beginning. What are carbohydrates? Well, carbohydrates are energy. They fuel our bodies, they give us energy, our cells. All of the cells in the body utilize carbohydrates or glucose for energy. And so we have different types of carbohydrates. We have simple carbohydrates, which are simple sugars, thinking like monosaccharides, glucose, fructose, as well as disaccharides like sucrose, aka table sugar. And then we have complex carbohydrates like starches, which are these long chains of sugars, and they also have fiber in them. So there's refined carbs, which lack the fiber and some of the micronutrients, which result in a fast glucose spike, rapid digestion. And we have unrefined carbohydrates, which have fiber, have polyphenols, which result in slower digestion and steadier glucose. And this fiber component is actually not digested as glucose. We have soluble fiber, which helps feed our gut bacteria, slows the absorption down. And then we have insoluble fiber, which helps promote bowel regularity. And what are some sources of these carbs? So refined sources, we can think of white sugar, white bread, white rice, white crackers. Remember, these are all devoid of that fiber. Even 100% fruit juice is considered refined because it does not have that fiber. And this will spike your blood sugar pretty fast because of the lack of that fiber, which helps slow the absorption down. And these refined sources is primarily where most Americans get their carbohydrates from, unfortunately. And this is really sad because we lack that fiber and the phytochemicals in whole food carbohydrate sources. So think beans, lentils, whole grains, oats, quinoa, brown rice, farro, buckwheat, vegetables, and even whole fruit with the fiber intact. And this is the type of carbohydrate we want to aim to get because it's going to actually contain these beneficial nutrients, provide fiber, and even the stable energy that we need. So how can we understand how these different carbs, these different sources affect our blood sugar? Well, we can look at the glycemic index and the glycemic load. So this is a helpful way to understand glycemic index. It tells you how fast a food raises your blood glucose, but it doesn't account for portion size. So it's really bananas have actually a lower glycemic index, so is dark chocolate, beans, whereas higher glycemic index foods are like watermelon and white rice. However, glycemic load is that index plus the amount eaten. So this helps predict more realistically our insulin response. And we're going to get into why that is important to understand. So, insulin and carbs. So, when we eat food, we spike our blood sugar, but that also triggers insulin to be released. So, when we eat, our blood glucose goes up. That insulin is released to help buffer the glucose out of the blood after a meal. Think having when you have refined carbs, you have that rapid glucose spike, and then you have these large insulin spikes. And that over time, a lot of insulin, it's going to start to get less sensitive which is not very good, and we're going to talk about exactly why. And our goal is to be very insulin sensitive. So we want our insulin to work really well because that's going to help us be the most metabolically flexible. And the carbs that help improve insulin sensitivity are going to be the whole carbs that have that fiber. So, one, when you eat them, it slows the glucose entry into the blood. So, it has a lower insulin demand to get all that glucose out of the blood, and thus it improves your insulin sensitivity. And a lot of us hear, okay, sugar, inflammation, carbs, inflammation. Yes, this is definitely true. So these blood sugar swings, say, from all of these refined carbs that don't have that fiber to slow it down, a lot of these spikes can actually cause oxidative stress in the body. It forms advanced glycation end products and activates inflammatory pathways. And this is like a recipe for driving inflammation. However, when we have fiber-rich carbs, this reduces post-meal inflammation, which is fascinating. It increases anti-inflammatory short-chain fatty acids produced in the gut, and it even improves your metabolic resilience. So not only does it help with insulin, it also can help with inflammation. And the gut health, I love talking about gut health. So what does that fiber do for the gut? It actually helps feed the gut. So fiber is fermented in the gut, and then it feeds your beneficial bacteria to grow and be able to thrive in your gut. And then it ferments and it produces short chain fatty acids. So especially butyrate is one we all know about. And butyrate is amazing because it strengthens the gut barrier. And it's this compound that is formed after that fiber is fermented. So it strengthens the gut barrier, it reduces inflammation, it may inhibit cell growth even. And this is amazing because we often think that for cancer, especially, we want to reduce our carbs, we want to reduce our intake of sugar carbs. So it's interesting because we want to have the high fiber carbs because they can actually help inhibit cell growth. And low fiber diets we see do the opposite. So they reduce microbial diversity in the gut. They're associated with increased cancer risk, increased gut permeability, or something called leaky gut, and even increased inflammation. So ultimately, it seems like these high fiber diets are really associated with a reduced cancer risk and even reduced cancer mortality. And weight. If weight is a concern, even if it's not, carbohydrates or whole food carbs help actually. So if we have refined carbs, again, we're increasing our total insulin, chronic insulin levels, and that actually results in more fat storage. So it tends to also produce more visceral fat, which is the fat around our organs, which is the most dangerous. And that even can produce inflammatory cytokines. And that whole carbs actually, they help improve satiety, they help support weight maintenance, and even can reduce visceral fat over time. So ultimately, our goal is to avoid that chronic insulin elevation, avoid inflammation as much as possible, and metabolic flexibility. The goal should be to actually maintain a stable blood sugar, which we can have from a high fiber diet, which also helps with our insulin sensitivity and increasing our microbial diversity in the gut. Now that we know about the importance of fiber with our carbs, how I want to test everybody, which of these meals, left or right, hope everyone can get this one, supports your blood sugar better. If you were going to eat this, which one might be better for your blood sugar and your insulin? All right, everybody's getting it. Perfect. Yes, the right one is definitely going to be the best one to have for our blood sugar, for reducing insulin in the body, and helping with weight maintenance and all of our hormones because it has the carb, so pasta, but it's also paired with fiber and vegetables and legumes too. Amazing. Great. So let's get into the carbs and cancer. So what is this connection and how, if someone has cancer or wants to reduce their risk of cancer, how can we do that if carbs are so good? So first, another question. What's one carb-containing food you've heard is bad for cancer, but you're not sure why? Let's see. I've heard potatoes, sugar, definitely, bread, candy, added sugar. Yeah, definitely. A lot of you are right. Yeah, perfect. Great. Okay, let's talk about it. So we've known that sugar influences cancer for a long time. Even back in 1920, Otto Warburg coined what's called the Warburg effect. And this effect demonstrated that cancer cells have this overexpression of glucose transporters on the cell. So, although I said all cells need glucose, but cancer cells seem to exhibit rapid growth with increased sugar availability. The cancer cells also optimize glycolysis. So they use pyruvate and they ferment it to lactate. And this creates an acidic tumor environment. And what that does for the cancer cell, it allows them to suppress immune cells and promote tumor growth. It also allows them to create their necessary components, such as nucleotides, lipids, and amino acid for cell division. So obviously, we see that and we think sugar is bad. But let's go more into it. So we know that sugar influences cancer growth. However, in this webinar, you're going to notice that it's not just that sugar pathway that influences cancer growth, but there's other things to be aware of. But let's talk about sugar. So we know that there's definitely this link between different types of cancers. So actually, breast, colorectal, pancreatic, and many other cancers have been linked to added sugar, independent of obesity and weight gain. And this is really interesting because although even if someone is not overweight or obese or have type 2 diabetes, that added sugar component can increase their risk of cancer. There was a really amazing study back in 1993 that was done for breast cancer incidence in women of Chinese, Japanese, and Filipino ethnicity in California and Hawaii. And they found that those that were born in the US had a 60% higher risk of breast cancer incidence than those born in Asia. And this was thought to be, and definitely is because the patients that were born in the US, they probably consumed more of a westernized diet, which is high in calories, high in sugar, processed food, and high in protein. And what's interesting about this study back then is that we've even confirmed that a lot of the increased cancer incidence around the world, around Asia even now, is likely due to the fact that around the world people are adopting more of a westernized diet, which is really unfortunate. But now we know that it has such a big impact in your cancer incidence risk. Also, in the Nurses' Health study, this was done back in 2021, and it's been a long-term study of hundreds of thousands of nurses and a health study that looked at their long-term effects of nutrition and lifestyle to their health and disease development. And they found specifically for colorectal cancer risk, over 2 servings a day of sugar-sweetened beverages had a 2-time cancer risk compared to having one or less per week. So there's definitely a link between the sugar and the cancer incidence. Going back to insulin, insulin also can impact cancer. So again, it's when we have high glucose, we have subsequent high insulin. And like I was mentioning, having that chronic high insulin can lead to insulin resistance. And this is when the body's cells become less responsive to the action of insulin, so less responsive to that glucose getting out of the blood and leading to elevated blood insulin levels. This in itself, these elevated insulin levels, creates a pro-tumorigenic environment driven by chronic inflammation with more fat, again, like I said, visceral fat, elevated free fatty acids, and more pro-inflammatory cytokines. And an interesting couple studies here. So in pancreatic cancer, they found that the average blood glucose within the first 3 months of getting chemo was a really strong predictor of survival. And even in another study, 2021, cancer patients who had diabetes but controlled their glucose, meaning their average blood glucose levels were less than 180, they had about the same survival as patients without diabetes. But those with poor glucose control, like greater than 180 average glucose, they had increased cancer mortality risk. And then finally, I wanted to share something positive because this sounds really scary, of course, but this study in 2024 was really, really interesting, and it looked at overweight, obese, pre-diabetic, and type 2 diabetic patients, and it investigated plant-based forward diets versus traditional low-carb diets that are for traditional diabetic diets. And what they found was that the plant-based diet interestingly reduced insulin and glucose significantly more than low-carb animal-based forward diets. So again, this really supports that carbs are not necessarily the enemy, but it's the type of carbs and the way that we control our glucose, which is what we need to focus on. IGF-1. So if you're a patient at CCF or if you've been following Dr. Longo, you've probably heard of IGF-1. But IGF-1 is insulin growth factor 1. It's a hormone and it's highly involved in regulating cell growth, metabolism, and survival. And we know that high insulin growth factor is associated with increased growth in the body and increased cell proliferation. And high IGF-1 levels are also associated with increased breast, prostate, colorectal, and lung cancers. And it's likely because it also activates certain proliferation pathways in the body. We do see that low protein and low refined carb intake, so low glycemic diets, has actually been associated with major reductions in IGF-1. And in the table on the right, we see that they compared that high protein, high carb, high refined carb diet versus low protein, low refined carb diet. And the low protein, low refined carb is the light line. And so they looked at different metrics of glucose, of IGF-1, of insulin and IGF-1 binding protein, and they found that that low protein, low refined carb was effective in all of those at lowering IGF-1, insulin, and glucose. Inflammation, chronic inflammation, as we talked about, is a really big hallmark of insulin resistance. So, and what is the tie to cancer? Well, we do see that cancer is tied to chronic inflammation. So we know that about 15 to 20% of cancers are preceded by infection, chronic inflammation, or autoimmunity. And this is well known. We know that conditions like inflammatory bowel disease, chronic hepatitis, Helicobacter-induced gastritis, or bladder inflammation can increase the risk of different cancers like colorectal, liver cancer, stomach cancer, bladder cancer. So this is a well-known idea that it has a big impact. And also a lot of these diseases or these precedents can be improved with diet and lifestyle. And finally, again, gut health. How does this impact our cancer rate? Well, we know that high fiber consumption is associated with a 22% reduction in cancer risk, as well as a 17% reduction in cancer mortality. I love this study that was done in colorectal cancer. They found that for every 5-gram increase in daily fiber, which is nothing, that's like some nuts and seeds and some legumes, like a portion, if that, was associated with an 18% lower mortality risk. And by the way, we saw more benefits, lower risk, the more fiber they had. So that is incredible. So no matter where you're at, even if you increase your fiber a little bit, that can really, really help. Specifically, these short chain fatty acids that are produced when that fiber is fermented in the gut, these molecules are associated with lower obesity, reduce insulin resistance and even reduce inflammation. And our next webinar is going to be on really in depth on the gut microbiome and cancer immunity in the next month. So be sure to look out for that because we will definitely be excited to go more in depth about this. And now I want to pass it on to Lotta to talk about the keto diet and how that can impact cancer as well.
Thank you so much, Shayna. Definitely great information about fiber, and that's going to be something really important to keep in mind as we talk about the keto diet. So first of all, I just like to have a very general open question. What have you heard about the keto diet and cancer? If you are familiar with the ketogenic diet at all, or if you've heard any association with reduced cancer risk, increased, nothing. Okay, great. So we have some new information to share with you today. Can raise IGF-1 and can be hard on the kidneys. Keto's good. Okay, great. So lots of reduced recurrence. Okay, awesome. So first, just want to describe what even is the keto diet. So the keto diet or the ketogenic diet is a very low carbohydrate, high fat, moderate protein eating pattern. And it's designed to shift the body into a state called ketosis. So normally our bodies use carbohydrates and convert them into glucose for energy, as Shayna was describing. Whereas on a keto diet, when the carbs are drastically reduced, the body begins to burn fat for fuel instead. And the liver produces ketones in this situation, which serve as an alternate energy source for the body and the brain. The typical keto diet follows a 4-to-1 ratio of 4 grams fat for every 1 gram combined of carbs and protein. However, there are some more moderate, low carb ketogenic diets that use this macronutrient breakdown more of a 5 to 10% carbohydrates or 20 to 50 grams daily, 70 to 80% fat, and 10 to 20% protein. And the way to monitor whether you're in ketosis is by checking your blood or urine. So the original keto diet was developed over 100 years ago as a treatment for epilepsy because there's evidence showing how the ketones can help reduce seizure activity. And nowadays, there's some additional emerging evidence about how keto can be supportive for certain mental health conditions, such as bipolar disease, and potentially certain cancers, including some brain cancers, which we'll discuss. So, how is the keto diet connected to cancer? Well, there's several reasons why a ketogenic diet might influence cancer biology. And the major concept is this metabolic theory of cancer, which is linked to the Warburg effect that Shayna described earlier. So when cancer cells rely heavily on glucose for energy, even when oxygen is available using glycolysis, the ketogenic diet's ability to lower both blood glucose and increase ketones may metabolically stress these glucose-dependent cancer cells. By reducing the available glucose, keto could alter the tumor metabolism and leave normal cells, which can use the ketones, less affected. However, we'll discuss some limitations of this concept, including cancer cells' ability to potentially adapt to use ketones for fuel. There's also some evidence that suggests that keto diets can slow tumor growth, which supports this theory. And a review from last year suggested that ketogenic diets can positively affect cancer-related biomarkers. And this includes by lowering blood glucose, lowering insulin, reducing IGF-1 or insulin-like growth factor, increasing ketone levels, improving body composition by reducing fat mass and particularly visceral fat, which is an inflammatory type of fat, and improving markers like C-reactive protein, which is a marker of chronic inflammation. And that was particularly in keto interventions that last longer than 12 weeks. So a lot of these biomarkers may sound familiar as what Shayna was describing of some things that are influencing cancer risk. But one limitation with this review is, or with the studies that were included in this review, is most of them just reported the short-term effects of these interventions. So looking at the biomarkers, but not actually verifying what the long-term effects of these changes were, such as on actual survival rates or cancer outcomes. And then beyond the metabolic effects of the keto diet, researchers are investigating whether it might enhance the effectiveness of standard cancer treatments. So there's some evidence in preclinical studies in animals where ketogenic diets have been able to show improved responses to therapies, including immunotherapy agents like PD-1 blockade in a melanoma model and tomaversitinib in pancreatic cancer models in animals. And then there's some human data, which is very interesting, although limited, suggesting that a ketogenic diet can improve tolerance to radiation and chemotherapy, which also can protect normal cells from treatment. So there's one study, which was a small study of 18 patients with glioblastoma, which is an aggressive brain cancer, where 6 patients were able to follow the ketogenic diet for more than 6 months, and the remaining 12 patients were not able to for challenges related to adherence and some other issues. But among the 6 patients who were able to maintain the keto diet, 4 of them were alive at 3 years, which is a survival rate of 67% almost, which is really significant for glioblastoma. And in contrast, of the 12 patients who were not able to do the keto diet, only 1 of them was able to reach 3 years, which represented a 58% difference between groups. And so this was a small study that can't prove causation, but it raises some important questions for further investigation of the keto diet in glioblastoma. And I also want to make sure to note that this was in combination with radiation therapy. So it wasn't keto used alone, but it was to support treatment. And then another clinical trial in breast cancer patients was a 12-week trial that found that those who were following the ketogenic diet during chemotherapy had greater tumor shrinkage and were able to reduce their stage of breast cancer compared to a control diet group who were not following the keto diet. However, the study showed that there were no significant differences in the patients who had metastatic disease, and that's the staging that is very important for influencing mortality outcomes. So these findings do suggest some potential synergy between ketogenic strategies and conventional therapies, but it'll be interesting to see whether there's some longer term, larger patient populations that can see who can truly benefit from these. And there is also something that we use in the clinic with some patients when indicated, which is a modified keto diet cycled with a longevity diet. And so one of the downsides of the traditional keto diet is that it tends to be high in red meat, animal protein, and saturated fat, and then limiting some of these very nutritious foods that Shayna was mentioning, the whole fiber, whole carbohydrate, high fiber foods. So there's some growing interest in whether we can combine standard cancer therapies with a modified ketogenic diet that is higher in plant-based foods and lower saturated fat sources, swapping some of the saturated fat for like polyunsaturated and monounsaturated fats that are beneficial for health and reducing inflammation. So we sometimes in the clinic cycle a plant-based modified ketogenic diet together with the fasting mimicking diet and elements of the longevity diet combined with the standard of care treatments, so whether it's radiation or chemotherapy, in certain advanced cancers, particularly brain cancers. So we have some research in the Fasting Cancer book and some clinical or case studies that show some evidence for this potentially being a beneficial adjunct to conventional treatment. We have a case, a report in glioblastoma, which is, like I mentioned, a very aggressive brain cancer, where ketogenic strategies may help slow the tumor progression. We had patients, or the study had patients who combined cycles of fasting and ketogenic interventions with standard treatment, and those who achieved blood glucose levels below around 83 milligrams per deciliter had slower tumor growth and longer survival, where about 20% of these patients survived close to 3 years. Whereas the patients who had higher glucose levels above that 83 milligrams per deciliter, none of them survived beyond 13 months. And then there's also a case report from 2018 that was published about a 38-year-old patient with glioblastoma who was treated with radiation, chemotherapy, and surgery, who completed fasting, a calorie-restricted ketogenic fasting mimicking diet that was supplemented with micronutrients, and also integrated some additional therapies like hyperbaric oxygen therapy to support his metabolic health. And he remained in good health and showed tumor regression for at least 2 years when that report was published. So there is some evidence about potentially modifying the keto diet and cycling it rather than doing it long term in some of these brain cancers and more advanced aggressive forms of cancer when the standard of care has not been shown to be enough to improve survival. So with all that said, what are some of the current limitations when we're looking at the keto diet and cancer? First of all, most of the studies are preclinical studies in mice or in vitro, or some small early trials in humans that are more to test feasibility and not efficacy. The feasibility test is because the keto diet is so restrictive that it can be very hard for patients to adhere to and not have side effects, including some side effects of weight loss or just the difficulty of maintaining that state of ketosis. There's also very limited outcome data and not very strong evidence that ketogenic diets can slow progression or improve overall survival in cancer patients. Most of the studies are small and short-term and very varied in design, but test more metabolic markers like blood glucose or body composition, or some of these shorter term items that we're able to actually monitor, which doesn't necessarily translate to better cancer outcomes. We just don't have that data yet for the keto diet. And then one of the biggest challenges is that cancer metabolism is not uniform. So while some tumors may rely heavily on glucose, which would support that rationale for the keto diet, some cancers may actually use ketones or fats to fuel tumor growth, or they may be able to adapt to use ketones to fuel growth. So in that case, the keto diet is going to be problematic and driving cancer progression. And we have some studies in both animal models and in vitro models where the keto diets are promoting growth. So there's one in mice where we saw that keto diets can reduce primary tumor growth, but actually at the same time, we're increasing metastasis through the upregulation of a protein called BAC1, which is linked to cancer progression and resistance to therapeutics like chemotherapy. Another study showed that some breast cancer models show that ketones and lactate can increase cancer cell stemness, which is associated with recurrence, metastasis, and treatment resistance. And then also in lung cancer models, we saw that tumor-initiating cells are able to switch from glucose to ketone metabolism under conditions of glucose restriction, like a keto diet, which allowed them to sustain growth. So definitely some important limitations to keep in mind. And just very important to remember that, cancer is a very broad class of conditions, and the metabolism and strategies can vary by cancer type and cancer staging. And so this brings us to what are the evidence-based diets, both for reducing cancer risk and for supporting cancer treatment and outcomes. So when we look at established evidence, a more plant-forward, whole foods-based diet is consistently across the board associated with lower cancer risk and is recommended by almost every major health organization, including the World Health Organization, the American Institute for Cancer Research, the American Cancer Society, multiple dietary guidelines from different countries across the world. So it's very evidence-based dietary pattern. And then in contrast, looking at the keto diet, we don't have long-term data on cancer prevention, but we do know that the food components of a typical keto diet, like red and processed meats or items that are very high in saturated fat, are consistently linked to increased cancer risk. And the keto diet cuts out many foods, such as whole grains, fruits, vegetables that Shayna was talking about, that are linked to not only a lower risk of cancer, but also lower all-cause mortality. So it's really important to consider just like the overall broader picture and evidence base. And this slide also shows some of the different ways that these dietary patterns can influence health. So both a keto diet and a whole foods plant-focused diet can reduce weight, inflammation, insulin, and IGF-1, all those biomarkers that Shayna covered. Whereas a more plant-forward, high-fiber diet will increase fiber, phytochemicals, and butyrate that can influence gut health and overall health too. And then the keto diet has the higher beta hydroxybutyrate, which is the ketone. And some potential challenges with the ketogenic diet that I already mentioned are the increase in animal protein, especially red and processed meats that are associated with increased cancer risk, increased saturated fat, cholesterol, decreased fiber, and then also some reduction in certain vitamins, minerals, and phytonutrients that can be antioxidants and beneficial for reducing cancer risk and improving outcomes. So lots to consider there and keep in mind. And with that kind of summary, I'd like to pass it over to Shayna again, who's going to talk about some practical strategies on how to include some of these beneficial carbohydrates in your eating pattern.
Yes, thank you, Lotta. Thank you for talking about the ketogenic diet and the pros and cons and what is most sustainable and seems to be our best at preventing cancer and supporting cancer treatment. Seems to be this whole food, plant forward diet. So, quick question. Name one fi high fiber food you enjoy or want to try more often. Maybe you thought, okay, after this webinar, now I gotta have more. My nuts, my seeds, legumes. Let's hear it. Oatmeal. Yes. Oats. Anything else? Legumes, almonds. Yes. Raspberries. Perfect. Seeds. Farro. Yes, I love it. We're all gonna have some legumes after this, I hope. All right, well, in order to support our blood glucose regulation, so we want to support insulin and those glucose spikes, here is a really great formula. So we want to look at our plate, and I love this visual by Harvard. So you can see about a quarter of the plate on the right is coming from whole grains. So not so much as we might think. A quarter should come from our healthy protein, whether it's fish, legumes, soy, tofu, anything like that. And then on the other side, almost half the plate should be coming from your vegetables, specifically non-starchy vegetables. Think broccoli, cauliflower, kale, and hopefully a mixture of all of that. And this on the left here is our breakdown usually. So you can see it's quite a lot of carbs, and this is primarily for a longevity diet or more of a Mediterranean diet. And that is really to have as much fiber as possible while keeping protein adequate to not consistently increase IGF-1 levels and moderate fat coming from healthy fats like olive oil, avocado, nuts, and seeds. And we really want to prioritize fiber. So often we hear we want to get 25 grams of fiber, but really we want to get at least 40 grams of fiber per day. This has been shown to have be associated with less chronic disease, less cancer, and even more, ideally. Over 50, over 60 would be great. But if you're consuming about 25 grams of fiber right now or lower fiber, you want to increase it slowly, maybe a little by little, increase more legumes or fruit or vegetables so that you don't overwhelm your system and your gut microbes grow and are able to digest the fiber properly. But then once you're able to, get about 40, 50 grams of fiber if possible. And you'll see here too, and you can zoom in on your own screen if possible, that legumes are a really great source of fiber. So lentils coming in at 15.5 grams per serving, split peas at 16 grams, and even just raspberries, I mean, still have 8 grams of fiber. But look, you can combine all of these and you can actually get a really great amount of fiber and a lot in legumes. So we often think, oh, I'll have a salad to get my fiber up, but really we want to pack it with some whole grains, some legumes to really get the best bang for our buck. And here I wanted to share some examples of breakfast, lunch, dinner, snacks to best optimize your glucose. So we always want to combine our carbs. So if you're having oatmeal, which is a carb, you want to combine it with some seeds, some nuts, and top it with some berries for that added fiber to slow the glucose spike in the absorption of the sugar. Same as avocado toast. If you're having toast, which is amazing, adding some avocado for healthy fats and fiber, tomato, hemp seeds, arugula is going to slow that digestion down. And some other ideas like lentils with vegetables, leafy greens, farro with some vegetables and chickpeas, white bean soup, sardines. All of these are amazing. And the theme is that all of these include a variety of fiber, but also are balanced in terms of the carb is balanced with extra fiber, healthy fats, and protein. And here's some hacks for your blood sugar. So to really optimize your blood sugar, if you have high blood sugar or if you're dealing with a cancer treatment, these are really good ways to support lowering blood sugar. So apple cider vinegar, or really any vinegar except balsamic vinegar, can actually temporarily block starch digesting enzymes, which is amazing. So if you have about 1 tablespoon diluted in a big glass of water before a meal, you can significantly lower that glucose response. Same with walking after meals. So muscles love glucose, and we see significant decreases in the glucose spike from people who are able to walk even 5, 10 minutes after meal versus someone who might just be sitting for a long time after. And then finally, cooking and cooling starches. So I wanted to mention resistant starch. So anytime you cook and cool, like sweet potatoes, pasta, brown rice, quinoa, it turns into like resistant starch. So maybe you've tasted your leftover rice or leftover pasta the next day and it kind of has a different consistency. It's because it has resistant starch built now. And what this does is it changes that compound of the starch and it helps resist digestion. So it doesn't actually raise your blood sugar as much as other starches or even that rice did a day before. So this has been shown also to improve insulin sensitivity and promote good bacteria growth in the gut. So you can get it by cooking, cooling, or you can get it from unripe banana, oatmeal, and legumes as well. So we've shared a lot about how to include more whole grains, whole minimally processed carbs. So what is one change you're going to make this week to eat more whole minimally processed carbs? Pumpkin seeds, fiber, amazing, cooking and cooling, great. What about who is not scared of legumes? Yes, more legumes. I love it. Nuts, perfect. Amazing. Good. Great. So primarily what we've been talking about today is the longevity diet. This diet was developed by Dr. Walter Longo, and it's really similar to the Mediterranean diet, but the difference is that this is more closely studied to reduce incidence of cancer and also help if you do have cancer or other chronic diseases. And it's a plant-forward diet that can be adapted for any cuisine. Primarily, like we've discussed, includes complex carbohydrates, low mercury fish, plant proteins, healthy fats, and plenty of vegetables, fruits, and colors. We want to minimize high protein foods and animal products, added sugars, refined carbs, and ultra processed foods. And we talk about overnight fasting and periodic fasting. However, if you want to learn more about this and whether it would be right for you, then you can look into a consult with one of us dietitians. And to recap what we've discussed tonight, carbohydrates are definitely not the enemy. We want to focus on getting whole plant foods, which are carbs, and fiber. This supports cancer prevention, improves metabolic health. And the gut microbiome itself plays a really big role in that cancer prevention treatment. And we help that by having these whole food carbs and fiber. Additionally, the longevity diet emphasizes variety, moderation, and important nutrient density. So I'm going to pass it back to Lotta to give us a recipe on something sweet that we can have, even though we want to reduce our sugar.
Thanks, Shayna. Yeah, so I wanted to share that if you follow us on social media or sign up for our newsletter or visit our website, we do share longevity diet inspired recipes, including this one for Valentine's Day if you're looking for like a last minute simple dessert to make for Valentine's Day or to give to somebody. But these are dark chocolate covered date hearts that are stuffed with walnuts, and it incorporates a lot of the principles that Shayna and I talked about today. So we have very high fiber dates, which are a fruit, a dried fruit that has carbohydrates, but there's a great source of fiber with it. And then you also have a little bit of fat from the chocolate and from the dates that's going to slow down the impact of that digestion from the carbohydrates into glucose and have a lower impact on your blood sugar. So if you want to get more recipe inspiration, you definitely sign up for our newsletter, follow us on Instagram if you're there, or check out our website. And then we also have booklets that are available for sale on our website, and all of the proceeds are donations to the foundation. So check those out. And we always like to know if you do end up making any of our recipes. So you can feel free to email the clinic or send us a message and let us know how you like our recipes. So yeah, thank you so much for paying attention throughout this webinar. We're going to do a little rapid fire quiz to see how much you were listening. So first question quickly, which ingredient has more fiber, white sourdough bread or seeded whole wheat bread? B, yeah, the whole wheat bread, you're getting fiber from the whole grains that are intact, and the seeds are going to add some additional fiber too. Next up, what's one benefit of consuming whole fruit compared to, say, something like a fruit juice? Fiber. Yeah, fiber stays intact, so it's going to have that reduced impact on your blood sugar. And then finally, true or false, increasing ketones is beneficial for all cancers. False. False, right? You guys are all paying attention, 100% perfect score. So yeah, some cancers can adapt to use ketones for fuel, so it's not beneficial for all cancers. All right, so thank you again for sticking around for our webinar. Just to reiterate, we are the Create Cures Clinic. We're a nonprofit organization with different programs that offer ongoing support and monitoring for patients with cancer and other chronic diseases like autoimmune conditions or diabetes, but also just for general health span and longevity. If you're interested in learning how to apply some of this nutrition research or lifestyle interventions to yourself, we look at every patient holistically, taking their biomarkers into account, their lifestyle, and then also in the case of different diseases, what stage they're at and what their treatment protocols are. It's a collaboration between our team of registered dietitians, molecular biologists, and Dr. Longo himself. So if you're interested, definitely reach out to us to talk about how we might be able to work together. And then I also want to share some of our upcoming webinars. So the next one will be, as Shayna mentioned, on gut health and the microbiome. So if you're curious about learning about fiber and then learning a little bit more about phytonutrients and probiotics and some of these other things that can influence our gut health, definitely check out that one on the 18th of March. And then we have one on nutrition, lifestyle, and managing the side effects of cancer in April. And then in May, it's Mental Health Awareness Month. So we're doing a webinar on how nutrition can influence mental health. And this is our contact information. I'll leave it up here at the end while we answer some of the questions that came in through the presentation. So if you do have any other questions, please locate the Q&A function, and we'll get to as many as we can in the next 5 minutes. So the first one I would love to answer. We have a question about psyllium husk, which probably a lot of people who work with me know that I recommend psyllium husk a lot. So psyllium husk powder is a good source of fiber, particularly soluble fiber. It's one of the richest sources of soluble fiber that can be really beneficial for blood sugar regulation, but also reducing LDL cholesterol. So it wouldn't be like the source that we'd recommend for getting all of your fiber from one supplement, because there are benefits to getting a diverse variety of fibers from different foods. But psyllium husk can be a great supplement to increase their intake of soluble fiber. And then also, if you're having it before meals, it can help reduce the blood sugar spike, because of the impact of the soluble fiber on slowing down that breakdown of carbohydrates into glucose. So with psyllium husk, there are some different brands that are tested for heavy metals. So that's just one consideration, is to make sure that you're getting psyllium husk from a reputable source that does heavy metal testing.
Amazing. Yeah, we love psyllium husk. And I saw a question too that someone said they soak their beans for 24 hours and rinse them and then cook them after soaking. And they asked, is this good for the fiber and the carbs? And it is absolutely amazing. And what that is great for is it reduces phytic acid. And that is amazing if you're new and want to introduce more fiber into your diet or more beans, but you find that you sometimes get bloated with them. Soaking and then cooking is a great way because that will make it a lot easier to digest. And someone asked also, how do you recommend increasing fiber as gradually as possible? And I would say just slowly add maybe some more nuts, some seeds, add a little bit of legumes with your protein. To really just sprinkle it on and see how you feel. But again, it might take some time for your body, for your gut microbes to grow and be able to digest that fiber.
There's a follow-up question about how can we tell if the psyllium husk supplements have been tested for heavy metals. The brands that do this will normally share that information on their website. So you can see tested for heavy metals. And this is actually applicable to like protein powders or any other supplements. A lot of good brands will be testing and showing their certificate of analysis on their website.
Great question. And we can also help. If you work with us, we can help and find the products that would be best for you and also how to introduce that fiber as well. And someone asked, wouldn't gluten be contraindicated if one is doing chemo and their gut lining is impacted? So that's a really interesting question, and it would take getting to know you and your individual situation. But a lot of times, especially in America, people think that they're very sensitive to gluten. And sometimes they are more sensitive to the pesticides that are sprayed on the plant. And finding that if you get organic sources, people can tolerate it much better. And it's again should be case by case. If someone really has celiac, they should definitely avoid gluten. But if you can tolerate it, again, these whole grains are really important for the gut microbiome. So that would be great to include as much as possible.
There's one question in the chat box about increasing resistant starch and whether you have to eat it cold or can you heat it up again. So you can reheat it. Once it's cooked and cooled, you'll create some of that resistant starch. Reheating may degrade a little bit of the resistant starch, but not all of it. So you don't have to eat cold rice. Something like fried rice, for example, when you're using pre-cooked rice and then heating it up again, you're going to get still the benefit of the resistant starch. And same things if you have like leftover pasta and instead of putting it in a pasta salad, you want to bake it or microwave it, you'll still get the benefits of the resistant starch.
Yeah. Someone else asked if they should avoid all fruits except for berries if they have cancer. Um, and my answer and our answer, I definitely would say a lot of fruits provide different benefits. For example, pomegranates are a really great source of fiber and they have amazing phytochemicals as well. And the theme with your plants in your diet should be trying to get as many plants as possible because each of them are going to provide another beneficial nutrient.
Yeah, and if somebody is concerned about certain fruits, like tropical fruits, spiking blood sugar, you can use some of the strategies that Shayna discussed to minimize the impact on blood sugar, like having it after a balanced meal that contains protein and fat, or pairing it with a source of protein and fat so that you're not going to have, and also being mindful of the portion size. But those will reduce the potential impact on blood sugar and insulin, which would be those biomarkers that could influence cancer risk. All right. Well, we're just over time. So thank you again, everyone, for being so engaged in this webinar. And we really hope you learned a lot. After we end today, you'll be getting a link to a survey, and it will also have the option for finding out more about the Great Cures Foundation, including options for donating or following us on our social media channels. So thank you again, everyone, and hope to see you at the next webinar in March.